Hello, everyone, and welcome to this special episode of Movember podcast series Beyond the Moustache, where we bring real conversation around men's health, breaking the silence and stigma that often hold men back from seeking timely care. My name is Simiran Choudhary, and this special podcast series is organized by Voice of Healthcare. So, today we are focusing on one of the most important yet least discussed topics in men's health, which is prostate cancer. It is a condition that affects millions worldwide, yet the awareness, especially in India, remains limited. And to guide us through this conversation, we are honored to have with us Dr. Anil Kumar Anand, Senior Director and Head of Department Radiation Oncology at Fortis Memorial Research Institute, Gurugram. With decades of experience in advanced cancer care, precision radiation therapy, and patient centric treatment approach, Dr. Anand has been instrumental in shaping prostate cancer management in India. Thank you so much for joining, sir.
Thank you very much for having me.
Thank you so much. It's a pleasure having you here. So, to begin with, as we are marking November and spotlighting on men's health, how would you describe the current state of prostate cancer awareness in India? And are men today more informed, or do misconceptions still dominate in our country?
I think what we have seen over the last, I think more in last 5 to 7 years, that the more and more men are getting diagnosed with prostate cancer, and this is because of when they go for routine health examination, routine health checkup, they get a simple test called PSA, prostatic specific antigen. It is a simple blood test, and if this level is high, so there is a suspicion of cancer. And most of the people I have seen nowadays, they are detected on this test rather than having any major problem. So I would say 60 to 70% get diagnosed with this test coming positive out of a surprise. It is big surprise for them. And only 20-30% have some symptoms of urine and other things. So that is how we are seeing now more and more men with prostate cancer.
I think so. If I believe you are seeing more cases out there, then I believe the screening is happening at a much larger pace or a better pace as it was earlier, after in few decades earlier.
Sorry, I did catch up. Yeah, sorry.
So I was saying ki if you are seeing more cases nowadays, it could be one of the reason that the screening is happening at a larger pace as compared to how it was used to earlier.
Definitely, the screening is happening because there is some a little bit more information coming in the media nowadays. We see newspapers, and there are special pages dedicated to health. And I've seen in many newspapers, so they are telling about the importance of early detection of cancer. And prostate is in men and breast cancer in women is being highlighted very well by the media, by social media, and other sources. So I think that is how we are seeing more and more patients.
Very rightly mentioned, sir, and it is because of the awareness, education, how it is being promoted in media. So, moving on to my next question, that prostate cancer is often called a silent disease because early symptoms can be subtle or easily dismissed. So, what is so important? Why it is so important for men to start talking about it openly instead of ignoring the early signs?
Yeah, so it's not the men are shy, but they are ignorant. So everybody says, oh, you are now 60, 70, now you will have some urine symptoms. So it is by age. So they ascribe it to the age rather than saying that the symptoms we should consult a doctor. So many times I've seen my own colleagues and my own people in the social circle, they're saying, ऐसा तो होना ही था. So this urine symptoms come. and it is a part of life, part of getting old. But I think we have to be very, very careful in just ascribing it to the aging. And there are some symptoms which are very sinister, and we will be maybe we'll be talk about this. For example, at night, if you are getting up more frequently, or you are not emptying your bladder completely, you pass urine and then you still have feeling of bladder not empty. And sometimes hesitancy means you go and the urine doesn't come, or it comes with waiting, or some people apply pressure, which is actually counterproductive. You don't pass urine. So these are the symptoms which are kind of sinister, and if we talk about them naturally, as you say, we will diagnose more people. And if we diagnose more people early, we will cure more.
He rightly said, and like you mentioned in start, it is more about it's not more about not knowing about it. It's more about the ignorant. That men are ignorant. They're not shy. I think that's why we came up with this campaign where we must talk beyond the mustache, specifically focusing on men's health. And thank you
Mhm.
so much for helping us to get that to spread that awareness and education amongst our public out there.
Yeah.
And so you rightly mentioned about the screening also, and it is one of the biggest concern for men. So at what age should men in India ideally begin prostate cancer screening, especially those with a family history? And how can men overcome the fear or stigma that often surround these tests?
Yeah. So the screening should start at the age of 50. And for people who have, or men who have family history of cancer, especially a family history of prostate cancer, then it should start at first test at 40. So therefore, after getting this test done, and then you see the levels, and if this level is below one and is fine, and you maybe you will repeat it after 1 year, it stays that level, then you need not get too often. So there is a definite protocol how you should go forward. It's not that everybody should have PSA every 3 months. Then it is over exploitation and unnecessary worry. So we have to balance out screening versus false negative and false positive reports, and unnecessarily building apprehension on people, while it is a very, very good test to detect early cancer.
Thank you so much, sir, for spreading light on that. Uh, so we know that most of the things happens because of the lifestyle we lead, and so when we're talking about lifestyle, if you could help us guide through the lifestyle changes that can genuinely help reduce the prostate cancer risk in our day to day life.
So I think as far as lifestyle is concerned, there is a overlap of bad habits of lifestyle. For example, obesity. For example, a lack of physical activity. For example, high fat diet. These are overlapping for heart disease. They are overlapping for prostate cancer. In women, they are overlapping even for breast cancer. So, a bad lifestyle can give you many problems, not only prostate cancer. So, lifestyle means you should have good physical activity. You should have a lot of green vegetables and fruits, and you should control your weight and physical activity. Now, these are the lifestyle changes which are easier said, but what I see here in our own country among the middle income and higher income group, people hardly walk. You see parks empty. You see gyms empty. Only few people on the treadmill, and the rest gym. Even if you have in your society, they're empty. So where the people gone, they're all sleeping. And so therefore, physical activity in our culture is not ingrained as compared to the West. So what we see here in our country, prostate cancer is diagnosed little earlier, maybe a decade earlier, or maybe 5 to 7 years earlier in India as compared to the West.
So what you mentioned is that our parks are empty, everyone is sleeping out there. This
Yeah.
reminded me of a conversation with Dr. Ashok Seth. He said
Mm.
the most of the person you'll see walking in the gardens or park or gyms are the one who already had that heart attack. So they are walking and doing this for the prevention. And the one who
Mm.
didn't, they are just going there, sleeping there, having food and everything. They'll do everything of this, but once they have it, then only.
Yeah. So that is the sad part. And the campaign like this, which we are kind of talking today about this, is that we should do all this when we are healthy. And I can tell you, if you do it, you will enjoy. If you start walking in the morning for 2, 3 months, then you can't leave it. Even the day when the day is not good outside, for example, nowadays there's a pollution, so you still feel very restless without going for a walk or without going for some kind of gym activity. So I think in India, although the government also is promoting sports,
Hmm.
but somehow in the schools and colleges, sports activities are not that much. So in our days, I would say, in our good days or olden days,
Golden,
we used to have,
golden days.
yeah, yes, we used to have a lot of sports activities in our school and sports activities in our, outside our house and in the neighborhood gardens. But that is stopped. Children are glued to the laptops and the mobiles. So this is all is interconnected. In a mobile, you are just spending 2, 3 hours. Children I have seen spending 2, 3 hours on the TV and on the mobile. So where is the physical activity? That is important.
I think so. You mentioned a point of where it has been. It used to be taught in school about the sports activity and how you can be more physical. I think this comes with a discipline which needs to be built at an early age, where your mind knows that you need to spend this much of hour or such kind of activity for your physical health. You've done your mental activity, you had your food and everything, and now it's time for something to burn the calories, to walk, to do something for yourself. That discipline needs to be there. And once it is done, I believe the food, the eating habits, the or the physical thing, the doing exercise and everything, excess of having junk food and everything will get in control. So
Yes.
that lifestyle change, that discipline needs to be there. And once India, or the mindset shifts from there, we'll definitely
Yeah.
beat prostate cancer or breast cancer or any other lifestyle disease mentioned by
Yeah.
you.
Yes.
So, yeah, you were saying something?
Yeah, so I was just mentioning just now, I heard that India is going to host Commonwealth Games in 2030. So it is a big opportunity for India and to showcase that we believe in sports activity, we promote sports, and sports is for everybody, not only for young people. Older people have different kind of sports, different kind of physical activity. I think it's a very important message. Physical activity and diet, both are extremely important.
Rightly said so. And our Prime Minister is also promoting campaign against obesity to be a fit India. So,
Yes,
so I think
that's
we
right.
should all collaborate for that.
Yeah.
Uh, so, as we just discussed about what exactly is prostate cancer, signs, symptoms, screening, how we can prevent it. Now, coming towards the treatment part, when it comes to treatment, not everyone is sure about what options exist. So, if you could walk us through the treatment options of prostate cancer today, which are available, and also if there's something which is coming up, because we are seeing a lot of technical and AI advancements happening in happened in last 2 to 3 decades, and what we can see more.
So, in prostate cancer, I think there are mainly three treatments. The first treatment, which we will have more and more if we diagnose more and more early cancer, is surveillance. Surveillance means just observation, no treatment, just observing with 3 monthly PSA, the test we discussed. So, if we diagnose prostate cancer in very early stage, when we say low risk, in the low risk there is some pathological criteria and PSA level criteria and all that. So if it comes to low risk, many times we will say a person doesn't need any treatment. What he needs is 2, 3 monthly PSA. So this is one of the treatment, but very few people qualify in our country for that. Second is, which is the most important, is either surgery or radiation. Now, these are the two modalities to cure prostate cancer. Either it can be cured by a very well defined radiation therapy or surgery. So there are kind of advances in both. While in surgery we now have robotic surgery, and radiation is also now has a lot of advanced techniques like image guided radiotherapy, we call it IGRT. Then we have on the CT scan guided, means CT linac. And now we have in India, for example, we also have at Fortis MR linac. So it is a MR guided radiation, because if you see, when we diagnose prostate cancer, we always do an MRI and never a CT scan, because prostate you can see very well on MRI as compared to CT scan. So, so we have in India right now two machines, one in Hyderabad, one we have at Gurgaon, and this is at Fortis Gurgaon. So this is a huge quantum jump over the existing technology, and it has the greatest advantage in prostate cancer. It is an MR guided radiotherapy for prostate cancer.
Thank you so much, sir, for explaining on the treatment options which are available and how beneficial it is. So, a follow-up question on that. A common worry for men is that treatment might affect their sexual function or the urinary health. So, how true is this concern, and how do you usually address these fears when a patient comes to you asking these questions?
Now, fear of surgery or fear of radiation? What fear they have?
So, fear of treatment, that after the treatment, it might affect the sexual function and urinary
Ah,
health.
yeah. So yeah, this is a very logical fear, and therefore, when a patient comes, we ask what is actually their, again, how is their quality of life, whether they are sexually active or not, and what is their desire. So if suppose somebody wants that his potency also to be maintained and cure is also to be done, so MR linac guided radiation therapy is extremely important, because in MR linac radiation we can save neurovascular bundles. So there are some nerves which we have to spare, we have to protect while delivering radiation, and if we do that, then person most of the times will have his potency maintained. So that is possible. It is also possible in some surgical procedures, but overall, radiation yields better kind of neurovascular bundle protection than surgery. So, therefore, that also aspect we should see. So, therefore, when patient comes, we offer them both surgery, radiation, and both of them in early stages of we call it low risk prostate cancer, both give equivalent result. Equivalent means cure rate in excess of 80-90%. So you would be surprised that in a cancer how you can have 80-90% survival, and that is exactly what we can achieve in prostate cancer. So in low risk, both give equivalent results. But if patient has locally advanced prostate cancer, diagnosed little late, and big prostate obstructive symptom, then there is a combination of hormone and radiation. Then the role of surgery is less.
Okay.
And so we give first hormone, shrink the prostate, and then we can do image guided radiotherapy. And if somebody can approach an MR linac, then maybe MR linac guided radiotherapy.
And so,
So,
yeah.
yeah, so again, even in locally advanced, you can achieve local control in the range of 80-85%. So that is the beauty of this treatment.
That's great, sir. And does this treatment options do we have? Does this also affect a person's emotional and psychological factors?
Yeah, so this is highly, I would say, under recognized, highly under recognized. Patient is hesitant to talk, doctors, they many times we encourage them to talk, but so there is a hesitancy in that. So there should be some privacy. So if their family is around, we tell them to go out, and then in privacy we should ask. And they have a lot of fear, but the good point is that if patient expresses desire and we offer him the latest technology, we can achieve this kind of results in majority of our patients. There may be few patients where the tumor is so advanced that it has involved neurovascular bundles. The cancer has involved. So then we can't protect. But in, I would say, majority of the patients, we can protect the potency.
That's great, and thank you so much for explaining us about the treatment, how it affects, all the misconceptions regarding this, sir. So now moving on our guests to a rapid fire round, short, sharp, and crisp answers from you, sir. So starting with my first question, one myth about prostate cancer you wish every man would stop believing.
Stop
Believe,
believing.
yeah.
Sorry?
So every one myth about prostate cancer, you wish every man would stop believing.
So that it is life threatening and he will have poor quality of life.
Okay. The most important test every month men above 45 should get it.
Serum, we call blood test, serum PSA.
Thank you, sir. And one early sign of prostate issues most men ignore.
The frequency and hesitancy in passing urine.
Okay. The biggest lifestyle factor that increases prostate cancer risk.
Lack of physical activity and obesity.
We talked about it. That's right, sir. One
Yes.
thing men can do today for better prostate health.
So, sorry, I didn't get. So, one thing, what man?
Men can do today for better prostate health.
So again, same thing. That physical activity and control of weight and less fatty diet. One thing I can, so it can be, it will be long answer, but there is some lycopene.
Okay.
Lycopene comes from tomatoes, and so this lycopene is protective.
Okay.
So maybe you can increase the intake of lycopenes. It may help.
Thank you, sir. So that was our rapid fire round. It was very quick and short. So before we end this conversation, I would not let you go before you give me a closing message that every man listening to take away about prioritizing their prostate health, and to focus that men should also focus on their health, highlighting the Men's Health Awareness Month which is going on.
Yeah, so I think the awareness about prostate cancer is only has started coming in the last 7 to 10 years, and I can tell you it has come from a screening, a health check which they undergo, which most of the companies also, when you join, they will recommend, and some media and print media and others, and journal discussions. So I think this PSA is doing a great job. We are saving many lives with the early detection, which we achieve with the serum PSA level. The second thing I would say is that nobody dies of prostate cancer. That is the usually people say, although few people do die, but majority will not die. So that fear should go. It is curable in low risk. It is curable in high risk. So therefore, we do a proper assessment and a proper treatment, good quality treatment, they can achieve high cure rates, very few side effects, and excellent quality of life. So that is the larger message I would like to give, is that early detection, if detected early, high cure rates without affecting quality of life, and that myth you are asking is that the person will lose everything. Is not there. He can be almost same as before treatment.
Thank you, sir. Thank you so much for educating, highlighting on the important aspects of prostate cancer for our public, educating them and making the society and community aware about the prostate cancer health. So, thank you so much for sharing the insights and helping us bring more clarity about this. So, it's a pleasure having you and hosting you on our platform.
Thank you very much for hosting me here. Thank you.
Thanks.